do not touch that pill bottle until you hear what I am about to tell you. Because one of the 3 most prescribed blood pressure medications in the world is producing a warning signal inside your body right now. And almost nobody over 60 has been told how to read it. Stay with me for the next 60 seconds. What comes next may be the most important thing you hear all week. I have watched patients sit across from me in complete disbelief when I finally explained what their own body had been trying to tell them for months. And before this video ends, I am going to give you the exact 5-word question you must ask your pharmacist at your next refill. A question that takes 10 seconds to say and could prevent years of damage that no one would ever trace back to the pill you trusted. If you or someone you love takes blood pressure medication, subscribe to this channel right now and turn on notifications. What you are about to hear could protect a life, possibly yours, possibly someone sitting across the dinner table from you tonight. I do not say that lightly. This information belongs to you, and it starts right now. My name is Dr. Clifford Adeshina. For over 2 decades, I have dedicated my life to one mission: giving adults over 60 the health information they deserve to have but rarely receive. Not because doctors are hiding it, not because the system is corrupt, but because a 15-minute appointment was never designed to cover everything that matters. This channel exists to fill that gap with honest information, with real research, with the kind of clarity that puts you in control of your own health. This is not a channel for generic advice. This is a channel for the truth that changes how you live. And before we go any further, I need to tell you something. In over 20 years of medicine, I have watched patients suffer for months, sometimes years, from side effects of blood pressure medications they were never properly warned about. By the time this video ends, I am going to give you a 4-step system I developed after 2 decades of watching patients get hurt by medications they did not understand. It takes 15 seconds to remember, and you will use it for the rest of your life. But first, you need to understand why you need it. And that starts with what these 3 drugs are actually doing inside you right now. Here is what keeps me up at night. More than half of all adults over 60 in this country are taking at least one blood pressure medication. Amlodipine, Losartan, and Lisinopril are among the most prescribed drugs on the planet. Billions of doses are swallowed every single year, and for good reason. Uncontrolled high blood pressure kills. It strokes, it blinds, it collapses kidneys. Medication saves lives. I am not here to tell you to stop taking it, but here is what the 15-minute appointment almost never covers. These 3 medications do not behave the same way inside your body. They do not produce the same warnings. They do not demand the same caution. And if you are taking one of them, or God forbid, 2 of them together with other drugs, without understanding the specific fingerprint each one leaves on your organs, you are making decisions with a dangerous fraction of the information you need. Studies published in the Journal of the American Medical Association have shown that adverse medication events account for over 1 million emergency department visits among older adults every year in the United States alone. And a significant portion of those events are not caused by rare reactions. They are caused by common side effects that were never properly explained. You are handed a bottle and a blurry printout. You are not handed understanding. To grasp why this matters, you need to understand something simple about how these 3 drugs work. Think of your blood vessels as a garden hose. Your heart pushes water through that hose. If the pressure inside the hose gets too high, it damages the walls over time. That is high blood pressure. Each of these medications lowers that pressure, but they do it by targeting completely different parts of the hose system. Amlodipine relaxes the muscular walls of the hose itself. It is called a calcium channel blocker because it blocks calcium from entering the muscle cells of your blood vessel walls. When calcium cannot get in, the muscle cannot tighten as hard, and the vessel stays wider. The problem is that when certain vessels widen more than others, particularly in your lower legs, blood pools where it should not, and fluid leaks into surrounding tissue. That is why your ankles swell. Your body is not failing. The drug is doing exactly what it was designed to do. It is just doing it unevenly. Lisinopril blocks an enzyme called ACE, angiotensin-converting enzyme. This enzyme is part of a chain reaction that tightens blood vessels and raises pressure. When you block it, pressure drops. But ACE also helps break down a substance called bradykinin. When bradykinin builds up because ACE is blocked, it irritates the lining of your airways. That irritation produces the cough, not a lung infection, not allergies. A chemical accumulation caused directly by the mechanism of the drug itself. Losartan works downstream from ACE. It blocks the receptor where angiotensin II would normally bind. Think of it as putting a padlock on the lock that angiotensin II uses to tighten your vessels. The lock is still there. The key just cannot turn it. But here is the part nobody emphasizes. Both Losartan and Lisinopril alter how your kidneys handle potassium. They can cause potassium to accumulate to levels that disrupt the electrical rhythm of your heart. And here is where it gets dangerous. Your kidneys are the organs that decide whether potassium stays or goes. When these medications change kidney behavior, potassium can drift upward quietly for weeks before any symptom appears. By the time you feel something, a cramp, a flutter, a strange fatigue, the level may already be dangerous. Now here is where this gets serious, and I mean that literally. Stay with me, because warning number 3 is the one sending people to the emergency room who thought they were being careful. But before we get there, I need to tell you about Margaret, because her story is the reason I decided to make this video. Margaret was 74 years old, sharp as a tack, still drove herself to church every Sunday, still cooked Sunday dinner for her grandchildren. Her doctor started her on Lisinopril after a blood pressure reading of 158/94. Within a month, her numbers looked beautiful, 128/78. She felt proud. Her daughter felt relieved. Everyone agreed the medication was working. Then, about 5 months later, Margaret developed what she called this miserable tickle. A dry, scratchy cough that would not quit. It was worse at night. It woke her up. She started sleeping in the recliner. Then she stopped accepting dinner invitations because the coughing embarrassed her. She told her daughter she was probably dying. She had been on Lisinopril for 5 months, and in all that time, not one person had connected those two facts. What Margaret did not know, what nobody had told her, was that the very enzyme the Lisinopril was blocking to protect her blood vessels was also the enzyme responsible for clearing a protein fragment from her throat tissues. That fragment was accumulating every single day she swallowed that pill. The cough was not a random side effect. It was a direct chemical consequence of how the drug worked, and it could have been identified, discussed, and resolved months earlier if someone had simply explained the mechanism when the prescription was written. Margaret's story is not the worst one I have seen. The worst one involves something sitting in your kitchen right now. I will show you exactly what it is in just a moment. But first, I know what some of you are thinking right now. You are thinking, I have been on this medication for 2 years and I feel off. Nothing bad has happened. So maybe this does not apply to me. And I want to respond to that thought with complete honesty. Feeling fine is not the same as being safe. Feeling fine is what most of these patients said. Right up until the morning, they could not stand up without the room spinning. So let me give you the 7 warnings that most patients never receive, starting with the one hiding in plain sight every single evening. The first warning is this: your body's swelling is not weight gain and it is not your age. If you are on Amlodipine and your ankles are thicker by evening, if your socks leave marks, if your shoes feel tight by afternoon, that is a pharmacological signature. It is the drug widening your arterioles more than your venules, creating a pressure imbalance that pushes fluid into your tissues. A study published in Hypertension, the Journal of the American Heart Association, documented that peripheral edema occurs in up to 10% of patients on calcium channel blockers. And it is dose-dependent, meaning the higher your dose, the more likely it becomes. Here is what I want you to do tonight. Stand in front of a mirror at 6 in the morning, before you have been on your feet, and again at 8 in the evening after a normal day. Photograph both ankles. If the difference is visible, bring those photographs to your next appointment. Do not describe the swelling, show it. That photograph is worth more than 1,000 words of description, and it gives your doctor something concrete to evaluate. The second warning is the one that sends people to the emergency room when they could have stayed home. If you take Lisinopril and you develop swelling of your lips, your tongue, your face, or your throat, especially if breathing feels tight or swallowing feels strange, you are experiencing angioedema. This is not the dry cough. This is a different mechanism entirely involving a rapid accumulation of fluid in deeper tissue layers. It can progress in minutes. A study in the Annals of Allergy, Asthma and Immunology confirmed that ACE inhibitor-related angioedema accounts for roughly 1/3 of all non-allergic angioedema cases seen in emergency departments. If this happens to you, you do not wait. You do not call the office Monday morning. You call emergency services immediately. And if you have experienced this even once, you must tell every doctor, every dentist, every surgeon, whoever prescribes you anything for the rest of your life. ACE inhibitor angioedema can recur if the drug is restarted, and it can be worse the second time. Remember Margaret? This is exactly why her story matters beyond the cough. Some patients on Lisinopril, who tolerate the cough without complaint, are simultaneously at risk for this more dangerous reaction, without ever knowing the distinction existed. Before I give you warning 3, I need you to understand something about your kitchen that almost no one over 60 has been told, because what I am about to say applies to millions of people watching this right now. The third warning hides in plain sight on your kitchen shelf. If you take Losartan or Lisinopril, potassium is something your body may be quietly hoarding. And potassium is not just in supplements. It is in salt substitutes, the ones marketed as heart-healthy alternatives to sodium. It is in electrolyte drinks. It is in certain herbal blends and seasoning mixes. A study published in the Canadian Medical Association Journal followed older adults on ACE inhibitors who used potassium-containing salt substitutes and found a statistically significant increase in hyperkalemia, dangerously elevated potassium. High potassium can cause muscle weakness, numbness, tingling, and in severe cases, life-threatening cardiac arrhythmias. Tonight, I want you to go to your pantry and read the label on every salt substitute and seasoning blend you own. If the ingredient list includes potassium chloride, potassium citrate, or potassium sulfate, and you are on Losartan or Lisinopril, that product needs to be discussed with your doctor before you use it again. This is not optional. This is urgent. I want you to do something right now while this is still fresh. Type the name of your medication in the comments below, Amlodipine, Losartan, or Lisinopril, and then tell me one thing. Has your doctor ever explained the mechanism I just described to you? One word is enough, yes or no. I read every single comment on this channel, and your answer will directly shape what I cover next. You are not just a viewer here. You are part of the research. Now I need you to pay close attention to what comes next, because the next warning is the one I see harm the most patients, and it is hiding in the most ordinary place in your home. The fourth warning is the one sitting in your medicine cabinet right now. Ibuprofen, naproxen, the bottle you reach for when your knee aches, your back throbs, your shoulder protests after gardening. If you take Lisinopril or Losartan, especially alongside a diuretic, regular use of nonsteroidal anti-inflammatory drugs can trigger what nephrologists call the triple whammy. A study published in the British Medical Journal identified this combination, ACE inhibitor or ARB, diuretic, and NSAID, as a significant risk factor for acute kidney injury in older adults. Each drug alone may be safe. Together, they reduce blood flow to the kidneys from multiple angles simultaneously. The kidney does not warn you, it simply begins to fail. If you need pain relief and you take blood pressure medication, ask your pharmacist tonight what analgesic is safest for your specific combination. Do not guess, do not assume. Acetaminophen may be an option, but even that requires professional guidance based on your liver function and overall profile. Here is a number that stopped me cold when I first read it. According to research tracking medication-related kidney injury in older adults, a significant proportion of cases involved over-the-counter pain relievers that patients never mentioned to their prescribing physician because they did not think of them as real medicine. They thought of them as something from the drugstore. That assumption is where the damage begins. The fifth warning is about your blood pressure numbers themselves. If you are monitoring at home and you see a reading of 150, do not panic and do not take an extra pill. If you see 105, do not celebrate and skip tomorrow's dose. Blood pressure is a moving target. It rises when you are anxious, when you are in pain, when you slept badly, when you rush to the monitor. A study in the journal Circulation demonstrated that home blood pressure readings vary by as much as 30 points, depending on technique, timing, and emotional state. A single number tells you almost nothing. What tells you everything is the trend over 2 weeks, taken at the same time. After 5 minutes of quiet rest, seated with your arms supported at heart level. If your trend is climbing, that is information. If your trend is falling too sharply, causing dizziness, fatigue, or near fainting, that is also information. Both deserve a phone call. Neither deserves a self-prescribed adjustment. I want to ask you something directly, and I want you to answer it honestly, even if the answer makes you uncomfortable. How many times have you adjusted your own medication, taken an extra dose, skipped a dose, changed your timing, based on a single reading that frightened you? If the answer is more than once, you are not alone. But you now know why that instinct, however understandable, can create the very emergency it was trying to prevent. The sixth warning is about dehydration, and it is the one that catches the most careful patients completely off guard. If you develop a stomach bug, a fever, diarrhea, vomiting, or you are sweating heavily in summer heat, and you continue taking Losartan or Lisinopril at full dose, you are asking your kidneys to filter under conditions they were never designed for. Frank, a patient I once treated, took his Losartan faithfully through a 3-day stomach virus because he believed missing medication was irresponsible. By day 3, he collapsed getting out of bed. His blood pressure had dropped to dangerous levels because his body was depleted of fluid, while the medication continued dilating his vessels. He ended up in the emergency department with acute kidney strain. The drug was not the problem. The timing was the problem. The rule is this: during any illness that involves significant fluid loss, contact your doctor before taking your usual dose. Most clinicians will tell you to hold the medication temporarily and resume when you recover. But you have to ask. They will not call you. They do not know you are sick. And the seventh warning, the final one, is the most important of all. The best blood pressure medication is not the one that produces the most impressive number. It is the one you can take consistently, safely, and without resentment for the rest of your life. Amlodipine may control your pressure perfectly, but leave you unable to wear your shoes by dinner. Lisinopril may protect your heart and kidneys, while destroying your sleep with a relentless cough. Losartan may be gentler on your lungs, but demand vigilant potassium monitoring every few months. The right medication is not determined by what works in a textbook. It is determined by what works in your body, alongside your other conditions, your other medications, and your actual life. If you hate how your medication makes you feel, you will eventually stop taking it. And the vast majority of patients who stop blood pressure medication without medical guidance experience rebound hypertension that is more dangerous than the original diagnosis. This is the moment I have been building toward. Everything you have just heard, the swelling, the cough, the potassium, the painkillers, the dehydration, the numbers, the consistency, all of it collapses into 4 letters. 4 letters that I want you to write on the inside cover of your medication notebook tonight. I call this the S.A.F.E. protocol. And after 20 years of watching patients get hurt by medications they did not understand, I developed it specifically for people in your situation. Stands for study your specific drug class. Know whether you take a calcium channel blocker, an ACE inhibitor, or an ARB. The class tells you the pattern. The pattern tells you what to watch for. A stands for anticipate the signature side effect. Every class has one. Amlodipine has ankle swelling. Lisinopril has dry cough. Losartan has potassium changes. Expect them. Recognize them. Report them early. F stands for flag every interaction. Every new medication, every over-the-counter painkiller, every salt substitute, every supplement should be reviewed against your blood pressure drug. Nothing is too small to mention. E stands for evaluate your numbers and trends, not moments. Track blood pressure at the same time daily, record it, and bring patterns, not isolated readings, to your appointments. S.A.F.E. 4 letters. 15 seconds to remember, potentially a lifetime of protection. Here is exactly what I want you to do starting tonight. Identify your drug class, look at your bottle, and if you do not know whether your medication is a calcium channel blocker, an ACE inhibitor, or an ARB, call your pharmacy tomorrow and ask. Write the answer down. Check your pantry for potassium-containing salt substitutes and seasoning blends. If you are on Losartan or Lisinopril, read every label and set aside anything containing potassium chloride until you have spoken with your doctor. If you use ibuprofen or naproxen regularly, bring the bottle to your next appointment and ask your doctor or pharmacist to evaluate the interaction with your specific blood pressure medication. If you develop a persistent dry cough on Lisinopril that lasts more than 2 weeks, call your doctor's office and ask whether it may be medication-related. And during any illness involving vomiting, diarrhea, or significant fluid loss, call your prescriber before taking your usual dose of Losartan or Lisinopril and ask whether you should hold it temporarily. Your ankle swelling is not aging. It is amlodipine widening your blood vessels unevenly, and your doctor can adjust the dose or switch your class if the pattern is documented. Your dry cough is not allergies. It is lisinopril allowing bradykinin to accumulate in your airways, and there is a safer alternative if it is destroying your sleep. Your potassium may be rising silently on Losartan, especially if you are using salt substitutes, and that invisible shift can destabilize your heart rhythm. Your over-the-counter painkillers may be quietly reducing kidney blood flow when combined with ACE inhibitors or ARBs, and that damage can be irreversible if left unchecked. Your dehydration during illness turns a helpful medication into a dangerous one, and a single phone call can prevent an emergency room visit. And your blood pressure numbers mean nothing without context. Trends, timing, and technique determine whether you are being helped or harmed. I promised you 5 words at the beginning of this video. 5 words that take 10 seconds to say and could prevent years of damage. Here they are. Write them down if you need to. Save this moment. Screenshot it if you can. The question is, what should I watch for? That is it. 5 words, every single refill, every time you pick up that bottle. Because that question forces a conversation that most pharmacies are fully prepared to have, and that most patients never start. The people who ask that question are the people who catch problems before they become emergencies. Starting today, you are one of those people. If there is someone in your life, a spouse, a parent, a sibling, a close friend, who takes blood pressure medication and has never heard any of what you just heard, I am asking you to share this video with them tonight. Not because this channel needs more views, because that person deserves the same protection you just gave yourself. Sending this video to someone you love is not a promotion, it is an act of care. It might be the most important thing you do for them this week. Subscribe to this channel and turn on notifications if you have not already. Every video I release is built around the same mission, giving you the medical truth that your appointment could not cover, in language you can actually use. And before you close this screen, I want you to answer one question in the comments. Not a reaction, a real answer. What is the one thing your doctor never explained about your blood pressure medication that you now wish you had known sooner? That question will help every other person reading these comments feel less alone, and it will help me understand what to fight for in the next video. In my next video, I am going to show you something that concerns me even more than what I shared today, because it involves a medication interaction that almost every person over 60 is making right now, and it has nothing to do with blood pressure pills at all. If you are subscribed and notifications are on, you will see it the moment it goes live. If you are not, you may miss the one piece of information that connects everything I told you today. Your body has been working for you every single minute of your life without asking for anything in return. The least you can do is give it the truth. I am Dr. Clifford Adeshina, and I will see you in the next one. Everything I have shared today is general medical information based on published research and clinical experience. It is not a personal diagnosis or a replacement for care from your own doctor. Always consult your physician or qualified healthcare provider before making any changes to your medication, diet, supplements, or health routine.